Ever experience vulvar itching and irritation? If you have, you're not alone. This is a common issue that many encounter at some point. It's not a topic typically discussed over coffee, but it's an important one nonetheless. It's part of our bodies, our health, and our overall well-being. So let's break the silence. The vulva can become irritated for a variety of reasons, each as unique as the individual experiencing it. But what causes this uncomfortable condition? There are several potential causes of vulvar itching and irritation. One of the most common causes is allergic reactions. These can be triggered by soaps, detergents, or feminine hygiene products. Just like skin elsewhere on the body, the vulvar area can react to these substances, leading to itching and discomfort. Infections are another major cause. Yeast infections or bacterial vaginosis can lead to significant irritation. If you've ever experienced a yeast infection, you know how uncomfortable it can be. Certain skin conditions, such as eczema or psoriasis, can also affect the vulvar area, causing itchiness and irritation. If you have one of these conditions, it's possible that it's contributing to your discomfort. Hormonal changes, particularly those that occur during the menstrual cycle, pregnancy, or menopause, can also cause vulvar itching. Douching and number of sex partners can also cause discomfort. Wearing tight clothing can lead to irritation. The friction and lack of airflow caused by tight clothes can create an environment that promotes irritation. Lastly, antibiotic or steroid medications can lead to vaginal infection, causing irritation and discomfort. Now that we know what causes it, let's move on to the symptoms. The symptoms of vulvar itching and irritation can be quite uncomfortable. It's not just about the itch. Often there's a burning sensation that can be equally distressing. You might notice a reddening of the skin, perhaps even some swelling. Occasionally, a rash might appear, or there may be an unusual discharge. If you notice a thin white or gray discharge, sometimes foamy, with a disagreeable fishy odor, or a frothy yellow-green or discolored discharge, it could indicate an infection that warrants attention from your primary care doctor or OB/GYN. If you're experiencing a thick white discharge resembling cottage cheese without any odor, it could indicate a yeast infection. Later in this video, we'll explore over-the-counter vaginal creams that can effectively treat this condition. Thankfully, there are several treatments available for vulvar itching and irritation. One of the first steps is to avoid known irritants. These can include scented soaps, douches, and even tight clothing that can cause friction. Instead, opt for gentle, unscented hygiene products and loose, comfortable clothing. However, it's not advised to douche if you've used a vaginal spermicide, cervical cap, or diaphragm for contraception. It's recommended to wait at least 6 to 8 hours after sexual intercourse to prevent a reduction in the contraceptive's effectiveness. Additionally, refrain from douching for at least 3 days after completing the last dose of vaginal antifungal medications. It's crucial to keep the area clean and dry, as moisture can exacerbate irritation. Wearing cotton underwear can help with this, as it's breathable and absorbs moisture. Now, if you're dealing with an infection, over-the-counter treatments might be your best bet. Antifungal creams or suppositories like clotrimazole, such as vaginal yeast treatment Sunmark 0.01 cream, or meconazole such as Monistat 3, can effectively treat yeast infections. If you're using blood-thinning medication like warfarin, it's important to consult with a healthcare professional before pursuing self-treatment. For inflammation and itching, corticosteroid creams such as hydrocortisone cream such as Vagisil Maximum Strength Feminine Anti-Itch Cream could be beneficial. This cream is intended for external use only. While addressing yeast infections, it's advisable to incorporate complementary therapy and begin supplementing with lactobacillus probiotics like urovaginal probiotics to promote the establishment of healthy flora in your body. Remember, always follow the instructions on the product label. Remember, while these treatments can provide relief, they're not a substitute for professional medical advice. It's crucial to seek guidance from a healthcare provider if you're pregnant, under 12 years old, experiencing concurrent symptoms of fever or pain in the pelvic area, lower abdomen, back, or shoulder, currently taking prescription medications or have chronic health conditions, dealing with recurrent vaginal infections or discomfort, or if symptoms persist or worsen. So, to sum up, vulvar itching and irritation can be due to a variety of causes, from allergic reactions to infections or skin conditions. Symptoms often include itching, burning, and redness. Non-pharmacological approaches entail avoiding irritants and ensuring cleanliness and dryness, while OTC choices encompass antifungal creams and corticosteroid creams, along with the use of probiotic oral medication as complementary therapy. But it's crucial to seek professional healthcare advice if symptoms persist or worsen. If you liked this video, please give it a thumbs up and subscribe for more helpful health tips.